Transposition of the great vessels (TGA) is an urgent sort of grave sort of diagnosis. So thereby, it is important. The As the name suggests, the aorta arises from the right ventricle, and pulmonary trunk arises from the left ventricle, which is not the which reverse is the case normally. So what happens? The aorta carries the deoxygenated blood, so patient will be sinused. And until unless there is a communication between the left and right by ASD, BSD and PDA, patient will expire. It's incompatible with the life. So these children do have sinuses in the early life. They have your hypoxia, hypercarbia, and your heart failure features. ECG, the dilatation of the both ventricles, and P pulmonary hypertension. Echo shows the transposed vessels as diagnosed, and can be your communications, the ASD, BSD, PDA, and can be there. The catheter, it confirms. So send him to an appropriate place, an appropriate person. So what they do, current balloon septostomy is the commonest procedure that is done to make a communication between your left and right. So it's done in the atrial level, and in an attempt to close the patient ductus arteriosus, prostaglandin inhibition can be useful. Finally, definite procedure is the arterial switch, shifting the aorta to the left ventricle, and pulmonary trunk to the right ventricle. That means normal position, imposition. Little bit of good amount of time. It is a little bit challenging surgery. Very few centers, very good few people can do it successfully. So know them and know that places until unless that patient will not be okay. Coronary artery, it is also to be switched and reimplanted to old pulmonary trunk, and then Rastelli procedure like Raskine, and then creating a channel of blood flow to the aorta. And similarly, master descending procedure can be done for the same reason. So definite procedure certainly switching, arterial switch, placing the aorta in the right ventricle, in the left ventricle, and pulmonary trunk in the left ventricle. So challenging surgery, and then outcome, a good amount of time. It is happy with the good center, early diagnosis, and then good experienced surgeon.